Hi, I'm Dr. Brian Gluvic. I'm one of the naturopathic physicians here at the Community Birth Program. And I want to talk to you about some simple strategies that you guys can do to ensure that your baby has a healthy start to this world. Your babies came from a very different environment than the one that they're in now. They spent 9 months in a very sheltered, protective, relatively sterile, chemically and temperature controlled environment with a very highly regulated, consistent delivery of nutrition via the placenta. All of this allowed for some very rapid growth and development to help your babies prepare for this new world. In this new world outside the uterus environment, they're exposed now to millions of new chemicals, changing temperatures, infectious threats such as viruses, bacteria. They have to obtain their oxygen now by breathing air, and nutrition through this whole new mode via their digestive tract. Fortunately, they come equipped with all of these physiological adaptations to help with this transition, such as newborn reflexes that facilitate the feeding and attachment to the mother, breast milk, which provides a host of immune factors, chemistry to inhibit bacterial growth, and a perfect blend of nutrients for each stage of development. The breast milk, along with the normal bacteria that take residence in the digestive tract, help with this remarkable development that occurs within the digestive tract, with the digestive lining and the immune system that's embedded within it. About 70% of our immunity is wrapped around the digestive tract. And the development of this immune system and digestive lining prepare your baby for all the changes that lie ahead, such as the expanding source of nutrition, solids, and protection against infectious threats. There is one particular challenge that babies have today. The environment is quite different than it was a century ago. And babies today have to adapt to many more chemicals in the form of pollution in the air and in the food supply. And this food supply has changed due to industrial agriculture and genetic manipulation. And all of this just make it a little bit more challenging for your babies to adapt to this new world. But they have the physiology, the tools. And with you as parents, you just need to be a touch more sensitive to their needs and what they're telling you in terms of their behaviors and symptoms and responding to these. And I'm going to talk about this today. It's really common for babies to struggle a little bit with all of these changes that their body is going through. As a result, they're going to experience some common symptoms and conditions, and we're going to talk about how we can help your babies adapt in these circumstances. The most common complaint that parents will bring their babies in to see me for is fussiness, which basically is your babies will experience this prolonged crying, arching their back, they'll have a difficult time with feeding, they'll be quite gassy. This fussiness is so common, it's often referred to as the period of purple crying, a normal developmental state. And sometimes this fussiness can progress to more severe cases, which we'll define as colic. And there are many factors that can contribute to fussiness in babies, but we tend to focus on the digestive tract because that seems to play a central role. There are other factors associated with colic and fussiness, such as muscular imbalances and some other conditions. And we will screen for these. But again, I often focus on the digestive tract because it plays such a prominent role. And there are two factors that influence digestive function: feeding and digestive flora. With breastfeeding, we're going to do a thorough assessment of latch, duration of the feeds, quantity of the feeds, and screening of the oral anatomy to look for barriers that potentially will interfere with latch and feeding. Sometimes the mom is eating foods that can also have an impact on the baby's physiology. We're going to explore these adverse food reactions by doing these trial eliminations of certain foods and then controlled reintroductions. And similarly, with formula feeding or mixed feeding, we can also look at some of the possible reactions to the carbohydrates and protein components of formulas, and we would switch formulas to do a possible trial to see if this is the case. But we often focus on the baby's intestinal flora. Recall how I said that the development of that digestive tract is strongly influenced by the interaction between the food, say breast milk, the digestive lining and surrounding immune system, and the intestinal flora. Now, for this development to proceed in an optimal manner, we need the right bacteria in that intestinal tract. And there are many factors, such as the mode of delivery, C-section versus vaginal, early antibiotic exposure, carbohydrate imbalances in feeding, and even the type of bacteria in mom's vaginal tract or possibly even in her intestinal tract will influence this. So we'll often do a trial with these normal species of bacteria, Lactobacillus and Bifidobacterium. We'll give this orally to the baby. And there are some good studies showing benefit of these bacteria in the treatment of colic. Sometimes associated with fussiness and colic are disturbances in bowel frequency. The bowel frequency, how often your baby has a poo every day, can vary greatly, from 8 times a day to once every few days in breastfed infants. But typically babies at your age here, where your babies are at, they'll have at least 3 to 8 movements a day. And this will potentially slow down at about 5-6 weeks. So what I pay most attention to is how your baby's doing in the context of these bowel movements. Are they excessively fussy, straining for long periods, gaining weight? Remember, their digestive tracts are just learning to adapt to this whole new mode of nutrition. Sometimes they stumble a little, and we need to give them a little bit of a push. Another very common condition, and again associated with the digestive tract, is reflux, where the movement of breast milk or formula is in the wrong direction. And this is most often associated with just spitting up and sometimes fussiness. But in more serious cases of reflux, which we call gastroesophageal reflux disease, the baby can experience poor weight gain, esophageal irritation, breathing issues, changes in behavior such as more severe colic. And constipation can often be associated with this. See, bowel movements are just a series of coordinated actions involving reflexes, muscle contractions, and they all start at the oral cavity and esophagus and make their way down. So what can we do for reflux? Well, we're going to explore different breast formula feeding positions, feeding positions, positions after feeding, and sleeping positions where the baby is more inclined, allowing gravity to assist with the proper movement of food materials. We're going to also look at adverse reactions to what potentially foods mom's consuming or different formula options. Did I miss anything? Remember that all-important factor involved in digestive tract development, intestinal bacteria. There are some really good studies showing that introducing these normal bacterial species can help relieve reflux symptoms. The last condition I wanted to mention is eczema. This is often the first allergy condition we experience in infancy, and it can progress to more serious allergic conditions such as asthma, food allergy, and seasonal allergies. We are in the midst of an allergy epidemic. The incidence of allergies these days is increased dramatically over the last half century. About a third of the population now develops allergies, either in adulthood or childhood, infancy. So what's causing this? Well, remember at the beginning of the talk, I mentioned how your babies are born into a completely different world than they would have, say, a century ago. We now have tens of millions of new chemicals in the environment, the air and the food. They weren't there a century ago. And our food supply has also changed. All of this may be playing a role in overwhelming the baby's immune system. So recent data strongly suggests that the first 6 months are critical for this development of allergies. In particular, it's the role of the intestinal bacteria, along with the human milk, that helps the intestinal lining and surrounding immune system to develop normally. If this feeding system and bacterial colonization are disrupted, this is what potentially can lead to allergy development. So think of that relationship between breast milk, intestinal bacteria, and gut lining and the immune system as a classroom, where the breast milk and intestinal flora act as teachers to provide lessons to the gut lining and immune system to develop in a way that they are ready for this new world, able to respond to infectious agents, but not overly reactive to benign things such as pollens and food proteins. So how do we prevent allergies? Well, fortunately, we have some good research to guide us. The first question to ask is, what is the risk? If mom and dad have allergies, this increases the likelihood that your baby will develop allergies. There's a genetic component. If your babies have eczema, they're already at increased risk of developing more allergies. So in these cases, you want to pay more attention to these risk-reducing strategies. The first is exclusive breastfeeding for at least 6 months, or for 6 months, and then continued breastfeeding for at least a year. This is where most of the evidence is in terms of reducing risk for allergies. If you can't breastfeed, there's a little bit of data suggesting that hydrosylated formulas, these pre-digested formulas, will help to reduce the risk of allergy development. There's been a temptation in the past to use soy formulas in the context of dairy allergy. Now, the problem with this is that the immune system quickly develops a reaction to the soy. So soy formula is another risk increasing practice. So we want to avoid soy formula. There's some good evidence indicating that delaying solid introduction to probably at least 5-6 months will help to reduce the risk of allergies. And we have this growing body of data indicating that normal bacterial species introducing these early help to reduce the risk of allergies in your baby. What do you do if your baby already has allergy, in this case eczema? Well, we look at some of the considerations we've already talked about. There's some decent evidence and a fair bit of experience with this in terms of looking at the mom's diet and possible reactions to foods that she's eating. So we'll do these trial eliminations and challenges. If you're formula feeding, we'll often switch to a hydrolyzed formula to see if that improves the eczema. There's some new data that has come out suggesting that these fish oils, omega-3 fatty acids, and vitamin D may play a role in terms of preventing allergies, and possibly they may have a role in terms of treating these allergies. Similarly with probiotics, a lot of data suggesting we can prevent allergies, and there's some recent data suggesting that it may play a role in terms of treatment. And with eczema, there's some skin care considerations. Often, probably the most important is just excessive bathing and excessive use of soaps. Another very interesting topic is just food introduction. Which foods, when to introduce solids. And we've got years and years of controversy, studies that flip back and forth. Initially, the recommendations were to delay allergic food introduction, but now research suggests that early introduction is preventive. This is something that I'm not going to cover here, but this is something that I go into much more detail, particularly in the context of the individual baby's history during a 4-month well baby visit. And that's where we talk about how this looks like, especially in the context to reduce allergy risk. And just a quick note about vitamin D. I'm sure most of you are giving this to your babies. Why you're doing this is because there's still, despite being in a developed country, we still have this risk of more severe bony abnormalities due to vitamin D deficiency. And it's very easily preventable with just a little bit of vitamin D. So 400 international units a day is that minimum amount that you need to prevent that deficiency. You can go up to as high as 1,000. So if you're missing doses, you may consider 1,000 perhaps every other day or every day with the odd day that you're missing. There's also some data suggesting that vitamin D plays an important role for a whole host of things, but the vitamin D deficiency may also play a role in terms of risk for developmental disorders, risk for allergy development. So there are many sort of functions to vitamin D. I also want to make a note, too. There are two things that I tend to reserve um, for babies in the first 6 months. I don't like to prescribe a lot of things orally, but the two biggest ones are vitamin D and probiotics, just because of all the benefits and then all of the studies showing minimal or no risk with these supplements. So to summarize, your babies just really need time to adapt to this new world. And you can facilitate this process by listening and responding to their symptoms. And when they start expanding their diet with solid introduction, just remember to emphasize a whole foods diet with lots of diversity. So I would love to meet your babies in person. So if you have any concerns as it relates to how your baby's doing or need any additional support with breastfeeding or formula options, please schedule an appointment with myself or any of the other naturopathic physicians in the clinic. After your maternity care is completed, you also have the option of well baby visits at our clinic with any of the naturopathic physicians. During a well baby visit, we'll do a comprehensive head-to-toe physical, discuss any concerns you have, and strategies to optimize your baby's development. Thank you for your attention, and congratulations.